Next question I have is about dairy. I heard you say that dairy can contribute to insulin resistance even on a low-carb diet, and that dairy is similar to morphine. Can you please explain that to us?
So what is the job of dairy? We want to take a young animal, we want to make it grow big and quick and fatten it up. So dairy has a reason for wanting to stimulate insulin, because insulin is actually the hormone of growth. It's not just helping fat tissue get bigger, it's also important for muscle tissue as well. It's why some bodybuilders have previously injected, they probably still do inject with it. So insulin is an anabolic tissue. So dairy actually serves that effect very nicely. So dairy actually does induce a degree of insulin resistance, which is actually good for growth. The thing is that we shouldn't be consuming dairy into adulthood, and it's also arguable about whether we should be consuming dairy from other species. It's not something that humans are necessarily adjusted to being able to deal with. Now, when we talked about the morphine effect of dairy. So here's the thing. So we want young animals to grow big very quickly. So to a degree, we need them to overconsume. We need them to put more energy in than they're burning. So we need to make it as delightful, delectable as we possibly can. Now, a lot of people are surprised to know that dairy contains a version of morphine which is even more potent than morphine itself. It's called beta-casomorphine. And if you tell your doctor this, they'll be shocked, and they'll do a little internet search and they'll bring it up and they'll go, oh my goodness, I had no idea. So, and this is, for some people, this is a problem. So obviously morphine infers an addictive potential, which it's in sort of short circuit the body's natural desire to restrain eating and sort of just hack that. It can also cause allergic type reactions. So some people will take a medication if they have autoimmune inflammation. They'll take a medication called naltrexone. So the therapy is called low dose naltrexone. Now, naltrexone is what we give to people when they have a heroin overdose, for example, because it blocks the action of morphine. And if somebody's stopped breathing because they've taken too much heroin, then it'll reverse that and they can start breathing again. Now, low-dose naltrexone obviously is having anti-morphine type effects. So I suspect that the people who benefit from taking low-dose naltrexone, all it is, it's just antagonising the morphine that they're likely getting from the dairy. And we also see that some people will say that dairy is incredibly constipating. And yep, that's absolutely a story that a lot of patients tell me. And we also know that opioids are very constipating as well. So when I was a junior doctor, we had a saying, the hand that writes the script for the opiates also writes the script for the laxative. Because we just know that if you give them the opiate and you don't give them the laxative, they're going to develop constipation. So certainly dairy does contain a form of morphine, beta-casomorphine, and that appears to have some problems for some people. And it likely explains partially the addictive tendency of dairy as well as its constipating effect on some people.
Yeah, and so you don't think people should consume dairy at all, not even fermented dairy like kefir and things like that?
I didn't say that. So it's all very individual. So there's no such thing as a one-size-fits-all diet. We know that most of the world is actually lactose intolerant, so they shouldn't be consuming dairy with sugars like milk in them, the lactose being a sugar and not being present in cheese and cream and things like that in any significant amount. But for some other people, dairy can be associated with autoimmune inflammations. So my feeling is that most people would be better not consuming dairy, but it's certainly true that some people can consume dairy and get away with it, and sometimes it's even on a scale. So some people might have butter, which is mainly fat. Some people might say, well, I react to butter, but if I have ghee, which is clarified butter, which is even more fat and even less protein, that's fine. Some people, we know that fermentation actually does reduce the effects of some inflammatory proteins, and some people tolerate yogurt much better than they do, other forms of dairy. But there's always, there's nuance to it as well. So if you're making your own fermented yogurt, that's one thing. But if you're buying yogurt in the store, if you have a look at the ingredients, you might see that it's got a culture and so on and so forth, and then it's got added milk solids. And often what they do is to get the fat content up after fermentation, they might add some unfermented, fat back in, fat solids or milk solids, and what you're basically getting is then, you're losing the benefit of any fermentation. And also some people with fermented foods, they might react to yeast. So when we do testing looking for reactivities in people's blood, we often see they have antibodies or immune proteins that react to yeast. So, yogurt might be problematic. It might reduce some of these dairy protein products that are causing problems, but they might be introducing some traces of yeast that they might react to. So there's certainly no such thing as a one-size-fits-all diet, and you can test for it. And I'm of the belief that most people don't need dairy. Certainly you don't need dairy to get your calcium. You can get calcium from other sources, and that's the big thing. There's actually some epidemiological data that finds an association of perhaps an increased incidence of osteoporosis in cultures that consume the most dairy, which is quite surprising given that we're led to believe it's the only possible source of calcium. But that's by the by. So dairy, I think, if most people are consuming it, they should consume it because they love the taste. It's important to them. It might be culturally important, so on and so forth. I don't think there's any particularly good health reasons why you need to consume dairy. But having said that, if you can consume it without any adverse effects, then it certainly is delicious.
Okay, so but if we do consume dairy, it needs to have, let's say, yogurt needs to have only milk and live cultures, and that's it, no other additives.
If you were, well, this point is, if you were trying to reduce or improve your tolerance to dairy by having yogurt, then make sure it doesn't have added milk solids, which defeats the point of the fermentation process.
Okay, great. That's great information. One more thing about the dairy quickly. Some people actually experience measurable improves in health outcomes when they start eating dairy. Do you think it's only because they're replacing junk food with the dairy, or it can be another reason? Can it be another reason?
I haven't actually met any of those people, so I haven't actually been able to interrogate them to see what other changes they're making in the diet. So it's a bit difficult for me to say, but I would presume, so often we see, for example, when people make dietary change, they go to a vegetarian diet and they feel that their health is getting better, then certainly in those situations it's very likely that it's due to the elimination of problematic foods rather than anything else that's going on.
Yeah. One more thing about the dairy. So we're so indoctrinated thinking that we need dairy for calcium. What would be your top food to have for calcium instead of dairy?
Look, well, I think sardines, small fish with the bones inside, is fabulous. I'm not much of a fan of people who talk about crushing up eggshells and stuff like that. That just seems a bit of a step too far. So if you really wanted to get a good load of calcium in, then sardines.
Great, thank you.